Now, India is seeing increasing cases of post-COVID symptoms, also now known as long COVID. There are newer symptoms that recovered patients are currently reporting, and it is mounting the challenge for doctors now who are still trying to understand the perils of COVID-19. They say the infection is here for a long haul. This is an India Today magazine special out on stands now.
Fatigued for months after recovery from COVID. Feel brain-fogged and zoned out all the time. Well, these are some common complaints that are coming in from people who are infected. Actor Malaika Arora is one of them.
I just feel nothing is happening. I just feel my body just refuses to respond to anything and everything. Yoga helped me later. During COVID, I was not able to do much. I was too weak to do anything, although they tell you, you should do a bit of breathing and all of that. I was in no condition because I was just too weak to do anything.
Bollywood star Bhumi Pednekar echoes Malaika's sentiments. She says, and I quote, "I feel like COVID has eaten up all my strength." But doctors are not surprised. They have warned that COVID-19 has a lingering impact. It puts patients at risk long after the virus has left the body.
With my digestion, I think a lot of elimination of certain food products and groups is what I'm trying to do now. I've taken some dietitian's advice and I'm working it on in my routine. But I really don't know what's going on. I know that I'm not 100%, and I might take a long while to get better and feel my 100% again.
In fact, COVID is leaving no organ untouched in the body. The Indian Council of Medical Research says if a person has symptoms 4 to 12 weeks after testing negative for COVID, it should be treated as a post-COVID syndrome. If after 12 weeks symptoms continue, the patient should go for an RT-PCR test. If positive, it means they have been reinfected. But if negative, it should be treated as long COVID.
Even after coming back from hospital, the problem was that breathlessness remained. Even going from one room to another room was a problem. Secondly, all the memories were vertical. There was no coherent, correlation between one memory to another. So, for example, if I'm reading a newspaper and there is something in that, then I will not be able to relate to whether I was having a tea or where I was sitting.
Patients with these long COVID presents with various symptoms. They can come to you with cognitive difficulties, which is called as brain fog. Patients may have anxiety, they may have depression, they may have tingling, numbness, they may have loss of taste and smell, which is persistent for a very long time. There can be persistent fever, sore throat, dry cough.
Doctors say more severe symptoms might also mean post-COVID thrombosis.
There are some blood tests which can be done, like D-dimer, to see whether there is any susceptibility to develop clotting in their vascular system. In those patients, they have to take certain drugs which are called anticoagulant drugs for a period of 3-4 weeks to prevent the attack of what we call thrombosis or deep vein thrombosis or pulmonary embolism or such type of diseases.
Secondary infections also make recovered COVID patients more vulnerable.
The 4 most common complications in the lungs of the patients who recovered from COVID that we encounter are, first of all, secondary infections. These secondary infections could be viral in origin, could be because of certain bacteria, especially the drug-resistant ones. They could be because of tuberculosis or due to fungal infections. Fungal, we all know, could be aspergillus or mucormycosis. Mucormycosis is also being labeled as black fungus, which is a misnomer actually.
Doctors in Delhi say they are seeing 25 to 30 patients on a daily basis who have post-COVID complications. From fever to lung fibrosis, the complications are leaving doctors flummoxed. Studies suggest that even asymptomatic patients are developing long COVID. Well, doctors advise caution. Plan, prioritize and not get back to work aggressively. That's the word of caution. Well, after recovery, still follow COVID-appropriate behavior and avoid crowds. Listen to your body and take help when needed. Sleep hygiene is important. Good nutrition and deep breathing may help you. In some cases, physiotherapy also helps. Clearly, the infection has a long haul. With inputs from Sonali Acharji, Sneha Mordani in Delhi for India Today.